the idea of being a physician, there's no physicians in my family, but I just love the science of it and just being there for people, being there with people. I did internal medicine first, which is adult medicine. And then as I looked at the different subspecialties, cancer to me was the most exciting. It's diverse. 3 out of 5 are cured. People come in and it's really, really scary to look at your mortality. So it's a privilege and an honor to be able to sit down with a patient. New patient appointments, we may take 2 to 3 hours and really just go over the data. How do people feel? What do we want to do? Really take some time and let them know that I'm truly there for them 24/7. So just knowing that someone's there for you, it seems to make a difference, and that the world is wide open. We'll get whatever data we need from whoever physicians we need, whether it's Mayo or Seattle or wherever it is. We want to always make sure we've got all the data we need to make the correct decisions together. But it's together that makes the huge difference.
Are you curious about discovering ways of making your life better? Then welcome to my podcast. I'm Bob Nickman, and this is The Exploding Human. Listen in while I talk with all kinds of people in the fields of personal growth, health and healing, alternative therapies, psychology, spirituality, environment, and the future. I'm looking for those answers that make life better for everyone. You'll meet cutting-edge practitioners, doctors, artists, filmmakers, business people, and those who have overcome challenges. The brave, the curious, anyone who is out there helping us humans to explore, expand, and explode. Welcome to The Exploding Human. My name is Bob Nickman, and my guest today is oncologist Dr. JUDY L. Schmidt, and we're going to be talking about cancer and all things surrounding that particular disease. But first, I would like to invite you to visit my website, theexplodinghuman.com. Over there, you can listen to all the episodes, read synopses of the episodes, see photos of my guests, little bio on myself. And if you'd like to support the show, there's a donate button. Much appreciated. You can also listen to the episodes on YouTube, which is The Exploding Human with Bob Nickman. Add the with Bob Nickman to find the YouTube channel. And there is also the Exploding Human Facebook page. Lots of places to listen to the show. As I said, Dr. JUDY L. Schmidt is an oncologist. She is also a doctor of internal medicine and a hematologist. She has been involved in the field of cancer for about 40 years and is now consulting in this field. She's had her own clinic, and we are going to talk about what cancer is, how the different cancers manifest in the body, treatments, cutting-edge treatments, and how people can live a life of prevention. The thing that struck me the most about JUDY is that she is very, very compassionate and really connects with her patients. And we talked a lot about the importance of that, along with the medical piece to helping to cure cancer. So please enjoy the episode. This is Dr. JUDY Schmidt. So I wanted to start with, I know that you have many degrees, medical degrees, internal medicine, you've done cancer, hematology, all kinds of stuff. Explain to people, because when I hear the word cancer, that's like the last word I want to hear. I don't want to hear it. It's like, and I think most people feel that way, but I don't really know. I know it involves the blood. I'm a super layman. I have had friends that have gone through cancer and different treatments. What exactly happens when somebody gets cancer? What is that? What exactly is going on?
Well, cancer literally means uncontrolled growth. So you can have cancers that start in a number of areas of the body, and you can have malignancies or cancers that are relatively benign, and then others that are much more malignant. So we can look at a relatively benign tumor, and tumor just means lump. such as a meningioma in the brain, or we can look at an incredibly aggressive, fast-growing malignancy, such as an acute leukemia. Cancers can come from a whole bunch of different cells in the body. You can have a primary breast cancer, lung cancer, colon cancer. So it can start in the epithelial cells, or you can have something called a lymphoma, which actually starts in the lymph system. Then there's other kind of malignancies called sarcomas, which start in the connective tissue. So there's all kinds of different malignancies. I don't even know the number. There's just many, many different types of cancers. Of course, the most common types of cancers are the lung cancer, breast cancer, and colon cancers. Prostate cancer, those would be the ones we see most commonly.
Yeah, I always think about when I hear somebody's got cancer, I think lung and I think colon. Those are the two ones I think of the most. And then, of course, lots of skin cancer, which for the most part is not the worst thing in the world to get.
Well, that's right. So like a basal cell cancer of the skin is a relatively benign tumor. It doesn't tend to grow and spread. In contrast, the skin tumor called melanoma tends to be very aggressive and tends to spread at a much higher rate than the basal cells and the squamous cell carcinomas in the skin. But still, even the melanomas, the far majority of those are cured.
Well, I'm one of those people. I had something on this left arm, and the dermatologist thought it was not a big deal, but it had been sort of crusty, or it's about 6 months. And I went in, and he goes, "Oh, this is nothing," and it was a melanoma. And he did the surgery that you're supposed to do, where you cut around a certain diameter and a certain depth. You can't even see the scar, and it's, he said it was all from the sun. I don't know, because I get scared when I see something on the surface. I mean, everybody gets scared. When I see something on the surface, I'm going, what's going on internally? And he said, he said, well, don't worry about that with this one.
Well, there's something called superficial spreading melanoma, which tends to be more on the surface. But like you're saying, it's the depth of invasion that actually portends the most malignant part of the melanomas. So that is the crux of melanoma.
Well, should I be scared? He said, they got everything, and they did another whole test and everything. So he seemed to think it was not a big deal. It was a long time ago. It was a few years now.
Oh, good. Well, it depends on the depth of invasion. For example, even if these melanomas are invading more than 1 millimeter, we want to actually look at the local lymph nodes to see if they're involved. So not to scare you, but what we look for is exactly how far that's invading in.
Well, I was told that it was discovered extremely early. And so I was happy about that. So that is a cautionary tale. I think that, seeing a dermatologist regularly in terms of anything that's going on in your skin is probably a good idea. There's an old Chinese proverb from Lao Tzu, which is, take care of problems when they're small and you'll never have big problems.
Boy, that's it with cancer.
Yeah, and that's how I feel about what happened in that situation.
Now, even all cancers, 3 out of 5 are cured. That's invasive cancers. That doesn't include the basal cell cancers and squamous cell cancers of the skin we talked about. Get in there, get the screening studies. Don't smoke. Don't be overweight. Exercise.
I do all those things. I mean, I've never smoked because it just bothered me to be around it.
Yeah. Yeah.
And I try to eat well. And I think, we were talking before the interview, when we were talking on the phone, that was the first thing you brought up was diet. And I find that an important piece, because I do a lot of stuff on, all different types of healthy eating and lifestyle. And when I hear, what I like to call conventional MDs talking about this stuff, I think that tells you that this is really important. What you put into your body changes what's going on inside.
Yeah, and being overweight may be the #1 cause of cancer right now. It looks like it's surpassed tobacco. So get exercise, 3.5 hours a week and get into the normal body weight.
Yes. And if you're reluctant to exercise, the way I started exercising, which was a very long time ago, was walk. Just start with a 15-minute walk and build from there.
Yeah.
And and you'll feel better mentally, physically, spiritually, if we want to go that far, which I will. And so, when I've got a doctor telling me to eat well, or eat intelligently, and don't put, things in your body that are not, they're not real, artificially, to me, it's like if you're eating like ice cream and chips and drinking sodas, you're basically just pouring poison into your body.
Chemicals, yeah.
Yeah.
Oof.
And
yep.
And so there is a preventative aspect to it.
Absolutely. And we've even got data in breast cancer that it may decrease the recurrence rate if you exercise and stay the right weight.
So apparently Disneyland, not the happiest place on earth. I'm thinking about all the obesity. Have you been to Disneyland? There's a tremendous amount of obesity at Disneyland when you walk around. It's shocking. They got the electric scooters for the morbidly obese to go around so they can eat this is not a indictment of Disneyland. It's just a characteristic. Yeah. So if somebody gets a diagnosis of any type of cancer, and they hear the word, they get scared, they get a little irrational, and I'm just speaking for myself. When I even heard you have a melanoma in your skin, I went, oh, I got real, and I'm looking all over my body for anything that's like anything, and I'm not finding anything, but there's an irrational, fear-based, and rightly so, or not, but what does somebody do? What is the best course of action? And I know that there's different hospitals and institutes that do better work for certain things.
Well, the dermatologist would be the one that you'd see for a basal cell cancer and a squamous cell cancer, and for early melanoma. The oncologist, oncology just means study of cancer. And so the oncologist we think of as the kind of the captain of the ship. We're the ones that look at the malignancy. Do we have the pathology right? Is it actually a different malignancy than what we were told? Do we have the right pathologist looking at the slides? Do we need a second opinion on that? Is it something that we're going to think we're going to need some radiation therapy for? Is it something that we're going to need some additional surgery for? So it really depends on the type of tumor. Now, if you take a sarcoma, which is a cancer of the soft tissue, connective tissue, there's where you want to generally go to a center of excellence. There's sarcoma centers in the United States. I'm sure down at UCLA, USC, up in Seattle is one of a really great sarcoma center, MD Anderson, Mayo Clinic, I'm sure Cleveland Clinic. So there's different sarcoma centers. And if you, ask your oncologist, where's the best place to go for sarcoma, they'll direct you. Now, 85% of oncology is practiced in the community. So, for most cancers, lung cancer, breast cancer, colon cancer, prostate cancer, the community oncologist is able to help out with most of those cancers. But I don't know, every person I see with cancer, I always think no matter how common the cancer is, what's different about this person? What's different about this cancer? What do we need to think about differently, with this person? And we carefully review the literature together. How has everything changed in the last few months, years? What do we need to do to get the best care? And I love giving information. There's guidelines now for the last 20, 22 years that we can show people that experts in the field have written up and rewrite every couple of months as data changes and improves, so we can give people guidelines and show them, okay, here's what the standard of care is for treating colon cancer. Here's what we want to get on the pathology. Here's what we want to look at with the surgery. Here's the number of lymph nodes we want to make sure have been excised, etc.
So it's gotten very defined about how to approach a certain type of cancer and what you can learn about it. So it seems like it's really important to be to advocate for yourself in addition to finding a great doctor.
Very much. You want to be as educated as possible. You want to, look on the internet, get the articles, bring them into your doctor. I always like, there's such a plethora of articles on the internet. I like to try to hone people down to the ones I think are the best, and then, start from there. But no, you know your own body, trust that, and you know how you feel. So the only way this can work is if the physician and the patient really work together and figure out what's best for that person.
That's really good information. And I like to hear when a physician says something like that, to empower a patient and not just blindly, trust what you're being told, because not everybody's great at their job and people do make mistakes, even if they are great. And I think it's really important. I had a friend of mine who had a diagnosis of a prostate cancer, and then he got a second opinion, and they redid all the tests. He goes, make sure when you go to another doctor that they redo the test. And it was a different type of cancer that he did not need surgery for. It was a very slow growing prostate cancer. And he was going to have, a radical removal, and he didn't have it, and he's fine. I mean, he's lived a number of years. It's a very slow growing type. I didn't know there was different types of prostate cancer. I just thought that was a thing, and then that's it.
No, about as high as a third, 25 to 30% of prostate cancer grows so slow that we don't want to do too much. We don't want to, do surgery and then a guy is impotent or has bladder issues or exactly all the potential surgical problems. So yeah, a number of malignancies, it may even be safe to watch them, like a real low-grade lymphoma. Same thing. That's not a poor choice. As long as you carefully watch everything, and you're educated and you agree with that, because sometimes these malignancies, grow so slow, but, people live a long time. And so you also don't want to have the complications of, an advanced cancer.
Yeah, I was at the dentist a couple of weeks ago, and he goes, well, I see a little crack in your tooth, but I don't want to do anything. Let's just keep an eye on it. And I said, that's fine. If it gets worse, could be a year from now, could be 2 years, could be never. I don't really know. So it's a similar thing, but stay on it. Now, I always ask people when they do things in life, like, you've dedicated your life to this. I mean, you've really spent, a huge amount of decades. Why this area of study? What was the catalyst for you wanting to, obviously you wanted to be a physician, but how did you select this area, and what is exciting about it to you? Because I find it really interesting, because it's such a calling to pick any field in medicine, in my opinion.
Well, I had kind of a crazy biochemistry instructor in high school, and he was brilliant and hilarious, and I loved the science. That kind of got me going. And then, the idea of being a physician, there's no physicians in my family, but I just love the science of it and just being there for people, being there with people. I did internal medicine first, which is adult medicine. And then as I looked at the different subspecialties, cancer to me was the most exciting. It's diverse. 3 out of 5 are cured. People come in and it's really, really scary to look at your mortality. So it's a privilege and an honor to be able to sit down with a patient. New patient appointments, we may take 2 to 3 hours and really just go over the data. How do people feel? What do we want to do? Really take some time and let them know that I'm truly there for them 24/7. So just knowing that someone's there for you, it seems to make a difference, and that the world is wide open. We'll get whatever data we need from whoever physicians we need, whether it's Mayo or Seattle or wherever it is. We want to always make sure we've got all the data we need to make the correct decisions together. But it's together that makes the huge difference.
Yeah, that's quite beautiful what you just said. I mean, I love the idea of the connection, because I think that's where healing comes. One human being connecting to another.
Mm-hmm.
Maybe somebody knows a little bit more about something, but we all know more about our own bodies than anybody, because we're with ourselves all day. And
that's it.
When I talk to any kind of doctor, there's two things I want. I always say this: I want competence, and I want a human. I want a human being. I don't want a machine who's learned all the right, chemistry and diagnoses and all that stuff.
Sure.
But I want somebody that is actually connected to me. And I think if you have those two things, then you can really go from there.
You got to be superb and connect. Absolutely. I mean, people want to know everything that's in my head about the science of it, and then to be present.
I'm 67 years old, and when I was a kid, doctors, so it was the 50s. I was born in 54, so the 50s through the middle 60s. When I went to doctors as a kid, they had an attitude that I don't see it as much anymore, which I'm happy about, of being like gods. Don't question me.
Yeah.
I'm the doctor. And I always had this sort of, it was intimidating as a child. And I remember asking a physician, he prescribed something to me in my early 20s. I don't even remember what it was. I said, well, what are the side effects? And he goes, you don't need to worry about that. It's that never happens. I said, well, can I take a look at the PDR? And he goes, how do you know about that? Like, what do you mean? How do I know about it? It exists. It's that book right there behind you. And he shook his head. He couldn't believe he'd never, ever been asked. And his platitude or whatever it is, his height of godliness was challenged in one way, but he was sort of intrigued by me, and he took it off the shelf and he found the medication and he showed it to me, and I go, okay, thanks. And he was like, he couldn't believe it. And I went, this is not right. This is not right. This should be a shared experience. And I find, because I interview a lot of practitioners in all kinds of fields in this podcast, and I have found, maybe it's because I'm an adult now and I'm, but I find that doctors now are much more human than they were when I was a kid.
Well, there's less errors. The tighter we are together as far as making decisions and being educated on those decisions. There's less errors, there's less medical malpractice, there's much more quality care, there's so much more satisfaction on both people's standpoints.
Yeah, it's great. I mean, we're here for a very short time, and we're together just by, who knows why you and I are here on this planet at the same time. Why not make it something special when you have time to connect with another person? It really is. Like you were saying, it's an honor, it's a privilege, and it's I love to hear this. I love to hear physicians talk this way. It's important to me too. And I didn't know that about you when we set this up. I'm just when I talked to you on the phone, I felt it, and now I'm seeing it even more. So thank you for what you're doing.
And patients shouldn't be afraid to get second opinions. If they ask their doctor for a second opinion and the doctor gets all irate about it, maybe that's not a doctor you want to go to, because we're really here for the patient. And if I can provide that service to that patient, well, that's a blessing. But if we need to either get a second opinion or go to someone else, whatever it is the person needs, they need to surround themselves with the team of people that they feel safest with. Naturopaths, massage therapy, whatever it is that makes them feel like they're in the most healing area that they can be in. And these people need to talk to each other so that we can communicate and work together for the patient's good.
Yeah, you were telling me about the clinic that you had in Missoula. Is that where it was? Yeah, and all the different adjuncts to the actual, radiation and, standard cancer treatments. Tell us about that, because that was really fascinating to me.
For about 20 years, I had a clinic that I ran. It was my own practice and had about 22 staff members. And we offered, my manager was actually a Reiki specialist, in addition to being a business manager. And then I had full-time massage therapy in the clinic, and that was available to people free of charge, the whole time the clinic was open. And then we had this little green tea station. And then we had other things like, body talk and, tried to naturopaths would come in. We tried to, really make it a healing place for people.
That's fantastic. I love bringing in all those different disciplines to, is it, and, when you talk about things like Reiki and different types of massage and sitting down with people and having green tea, this is telling me that the factor of stress is a big piece of health issues. And,
sure.
I whether this is accurate or provable or anything, I think people can make themselves sick with the way they think and creating stress in their minds. And I don't know, I'm not saying that, I'm nervous about this job interview next week and I'm going to get cancer. I don't look at it that way. But if you have this sort of ongoing internal turmoil and your body is firing cortisol constantly and the adrenals are stressed, that's actually a physiological thing that goes on. What are exactly. Can that create dis-ease?
Well, you wonder, like you say, it really impacts the immune system.
Yeah. Do you see a lot of history in families of certain types of cancers? Is that an actual thing? It's like, well, my family, we're all obese. We're all, we all have diabetes. We have, what is the difference between sort of this genetic piece of it and lifestyle?
Well, genetics is very important in medicine. We're learning more and more about that. Colon cancer can be genetic. Breast cancer, we see it be genetic. Even melanoma is genetic in some families. We're starting to identify genes that are present in these families, and not only identify these genes, but now we're developing targeted therapy against these genes that actually prolong people's lives if they get the cancer. So many cancers can run in families. And the lymphomas, we sometimes wonder if people are getting exposed to the same toxin as far as getting same people in same families getting the disease. But that's just explosive. Maybe 5 to 10% of cancer is genetic.
Okay, I was wondering about that.
What we want to do is, for the patient that has, say, their dad had colon cancer at age 45, well, then we want to start colon cancer screening at age 35 and get a colonoscopy every 5 years. So we really look at family history and try to make good screening recommendations. Yeah,
that's what they say. And what about some of these colon cancers that aren't invasive, colonoscopies that aren't actual invasive? They just take like stool samples and put them under a microscope.
I think it's a possibility. You want to do that in the person that has an average risk, not someone that has an increased risk of colorectal cancer. The best test for colorectal cancer remains the colonoscopy, because not only can you see the colon, but you can biopsy and take anything abnormal out, such as polyps.
Yeah. I don't know if this was funny. It was funny to me. I took whatever the medication is that they kind of put you in the twilight. And I felt something and I went, ow. And I hear the doctor go, sorry, I'm making a turn. And I was kind of, tripped out on this stuff. And I started laughing while I was, and then I went away. Yeah.
You went away. Yeah. A little bit
Yeah,
more
Versed, that's
please.
what it was. Yeah.
Yeah.
I was like, sorry.
Yeah. I'm all about screening studies, Now we do lung cancer screening, people that have smoked more than 30 pack years, 55 years of age and over, up to I think 75. We do a screening CT scan of each year. We show them that decreases the death rate of lung cancer by 20%. You mentioned melanoma right at the start. People seeing a dermatologist once a year is not a bad idea. Even dermatologists can miss melanomas, as you point out. But, they're the best screening for melanomas besides, I think, a good cancer doctor.
Yeah. What is going on now? Let's talk like some of the newer treatments, newer diagnostic tools, cutting edge of cancer. Where's that happening? What's happening?
Well, I think some of the exciting areas in medicine for oncology are some of the targeted therapy that's being developed. We check the genetics of these different tumors now, and then based on those genetics, we may have immunotherapy that is active against them in advanced disease. So we're getting more away from the cytotoxic type chemotherapy that we've used for years and years, like Cytoxan and adriamycin, and more towards immunotherapy. So that's pretty exciting. But immunotherapy can have potential side effects as well. So, we're continuing to look at how to make these treatments not worse than these diseases, is always our goal, because, we know that some of these chemotherapies and immunotherapies can have great responses, but we don't want it to be at the cost of quality of life. But targeted therapy and immunotherapy is exciting. Some of the new radiation therapy that gets more and more localized like, for example, with even melanoma that spread to the brain, now we can do special stereotactic or gamma knife radiation therapy that really is localized to just where that tumor is. And you see people live for many times longer than we used to 20 years ago.
I didn't know about that. That's really interesting. It's almost like laser surgery, but with yeah, man.
It is. It's been really nice, and then you don't have so many side effects.
Yeah, that would make sense, because I think that's probably what a lot of people are like. I don't want to deal with this. I don't want to, a friend of mine's father, this is, 30 years ago, he said he got cancer. He said, I'm not doing anything. I'm not going through that. And he didn't, and he passed away, and he was fine with it. He goes, I'm not going to go through it and then die anyway. What's the point? I'll just go a little bit earlier. That was his attitude.
Yeah. That's it. You got to look at the risk and the benefit of everything that we do. Exactly. If you're looking at adjuvant therapy, say you've got a 50% chance that breast cancer is going to come back after surgery, and you do 8 doses of chemotherapy, and that decreases the risk to recur by 30 to 40%. Maybe that's something you want to do on the short term to decrease that recurrence rate. But in advanced disease, you never want the treatment worse than the disease itself.
Yeah.
You want to improve the quality of life for people. Most people want quality of life more than longevity, although obviously we want both.
I'm on the side of both.
Yeah.
Now, I've had two people that I know, and they were two different types of cancers, I think. One was it's one of my podcasts, if anybody wants to listen to it. The guest is Gary Stromberg. He's a friend of mine, and he had a bone marrow transplant that was very successful, of course. But they basically, what that involved was killing off his entire immune system, and being and then having the bone marrow of a donor. He has a new blood type. He became a meat eater from being a vegetarian. That part was really funny, because the doctor had said to him when he left, after all the stuff, he said, you may want to eat meat. And he goes, no, I've been a vegetarian for 30 years. On the way home, he pulls into an In-N-Out burger. He goes, best burger I ever had. And he's done very well. He's got a whole new existence. And he said it was from a rogue gene, is how he put it. is what caused what he had.
Yeah.
Then I had another friend who had he had been treated with he had it was like colitis and a lot of things with his intestines. He had been treated with steroids and I remember having a conversation with him, and he said, these steroids are probably going to kill me. He goes, that's what's going to happen. And it turned into some sort of a cancer that kids get, but it's very virulent in adults. I don't know the name of it. And they were doing some sort of a treatment with killing his immune system to do this, and he didn't make it. It was heartbreaking, but it was the only sort of chance that he had because of how rapidly this type of cancer. I don't remember any of the names because I don't want to. So I saw sort of this very similar types of treatment go two different ways.
It's some of that treatment's rough. Bone marrow transplant, you just tell people you're going to get sicker before you're going to get better, much sicker. So we just got to get through the next couple of months, and then we'll know.
Yeah. I don't know what I would do. I honestly don't. I don't want to ever have to make a decision like that. But, and you get to, as a doctor, you get to get close to people in this very intimate way with life and death, and then they don't make it. What is, how do you, over the decades that you've been doing this, what is that like? How do you leave a situation like that, go home and knowing you have to go back the next day and deal with people who need actual help, but there has to be some sort of a, how do you process that? I just, I don't know if I have the fortitude or the whatever it takes to do that. That's the part I find so impressive about physicians, that they can be human, see that kind of suffering. What's the grief process like for a physician? Because it has to be short enough that you can go back and help somebody else, but then it also lingers too, I would think.
I've got to be available right for the next patient. Sometimes I just stop outside the door when I had a clinic in Missoula and just erase my mind for a second and then get fully into the next patient, because they want you totally present. I don't think it's anything that you ever get used to, of course. But for me, dealing with all these patients and all these patients that have died over the years, I know that together we've done our best. And I know that I've been by their bedside as to relieve any suffering that I can. So, there's some kinds of suffering that I swear you cannot get rid of, some types of emotional suffering and some types of spiritual suffering. There's some things you just can't resolve, but at least I can sit by their bedside and be by them, and whatever they need and whatever their families need, so that I know and they know that we've done our best together. And I think that's what people want. I mean, people don't want me to be completely devastated. They want me to help each person. They want me to be available. They want me to use my science. They want to, me to be present, but, not detached, but, just know that we've done our best. And
focused on the next positive result that's coming.
And whether it's, it doesn't matter whether it's someone, dying of lung cancer or someone that has a basal cell cancer of the skin. Each of those people are looking at their mortality in some way. So, the other thing is we just don't judge that. We want to be present and really look at, how are you feeling about this? What do we need to do?
I'm going to ask you a question, and you may not have an answer for it, or you may. Have you had any visitations, either in dreams or from people that have passed that you've worked with, or an experience in a twilight situation, or just sitting at your desk? Or tell me something. Like, you're smiling in this beautiful way right now, which is telling me yes, something's happened. Things have happened.
Well, I had this very, very intuitive nurse. And she would get strong impulses. In fact, I remember this one time I was helping a patient who had a had an arrest at the hospital, and she said she had stopped her car at that exact same moment and felt this incredible energy, and called me up and said, what's going on? I think of the patients constantly, not constantly, but like we had this group of patients that would come on Tuesdays. So they called themselves the Tuesday Club. And there was so much camaraderie with that. I think of those men and women, and I don't know, it's just so special. My nurse has had a lot of experiences, and she shares those with me.
One of the things I love about doing this podcast, because I know that there's something else besides what we can see in the conventional way, that there's these other types of energies and connections between us and the veil of death, which is not really it's almost non-existent, is what I'm starting to realize, that the difference between here and there is not really that big of a thing. And I think most people have had relatives that have passed away, and they've come, they come to you in your dreams, or you have a moment where you go, oh, I know my grandfather's here. I can feel him. And you don't question it. You don't go, I'm weird or any of that. You just don't. You just go, oh, okay.
My little sister passed away, and I'll frequently, or not uncommonly, see her and take a second look. I'll feel her looking over my shoulder.
Yeah. And, those things, they've been around since the beginning of humans, but they're getting talked about more. And I think that's important. I think that when we bring that into the big picture, then we realize we're not separate. It's just this other sort of beautiful tapestry that is timeless.
Yeah, I like that separateness, to get rid of that.
Yeah,
I agree.
And I've been, I was listening to it was a heart surgeon, and he was talking about connecting to his patients through the heart, but not in a physical way, that he would feel certain types of vibrations and energy. Now, because when you think about it, I have a heart connection. That's not a physical connection. That's you can't touch that. My heart is broken. I know it in my heart, a knowing. And so I think that's throughout the body, that there is, it's really the big question is what are we? What are we really? I mean, we're walking around in these little bodies and suits made out of skin and all these other things, but what are we in there? And is that where the big healing is going to come, is knowing what that is? Are we going to be able to, and I'm getting way out here, but I like this stuff. Are we going to be able to tap into that in new ways, that's how we're going to heal rather than this mechanical way? And I think we'll probably be doing both. Well, and I always think about dentistry. I pick that because it seems the crudest. It's as close to construction work as you're going to get. It's sawing and cutting and pulling and drilling. It's very, construction work. But when I hear a heart surgeon talking about connecting in this other way, and I think you do that too. I can see it by the way you're looking at me right now.
And one of my nurses, my head nurse, used to, if the patient was into it, she would actually hold their hand, and you could just feel the energy, and she'd circle their heart and just give that energy and just calm to that patient. The other thing we used to do was actually have dogs in the office. And sometimes that was the most beautiful thing to see. My dog, little Shih Tzu, used to climb up on people's laps who really needed that right then. And just that little bit of healing touch, whatever it needs to be.
Yeah, they have instincts that are much more, certain types of intelligence that are so on the surface. Pets have that. I remember walking with my friend's dog in the woods when I was in my 20s, and I fell down and I hurt my leg. And, I was able to get get up and get, but when I was on the ground, the dog came to me and was just like whimpering next to me and just like snuggling me and trying to help me. And I went, wow, this is the most intuitive pet. Then other pets wouldn't even pay attention. They'd be off chasing something else. But, this was such a sweet moment. And I went, okay, well, who's the smart one here, the human or the dog? So, when we talk about intelligence, there's different types. Where's your nurse now? I'm curious about her.
She's retired.
I like her. Now, when you first saw that kind of stuff, was it odd to you, or did you come from a family that had an openness to those kinds of things?
Boy, just knowing her and just feeling that energy, just stopping and just being aware of that. I had very little, if any, exposure to that, but she really opened my eyes.
Some people just know that stuff. They come into the world and they know it. Or maybe they had a mother or a grandmother or somebody that had that, and they pass it on a little bit, or they make it okay. And when you
they make it okay, instead of suppressing that. I think.
I mean, everyone's had this experience where you're in a room and there's even an expression for it. The hair on the back of my neck stood up, and then you look, and some really unpleasant person is there, and that you didn't see, you didn't hear them. They're not in the mirror. They're there. And the hair on the back of your neck stands up. Well, what is that? How is that traveling to you? How is that? And that's sort of a negative way, but but I also think it's an instinctual sort of primitive way of survival that the humans have always had for predators. So, you don't really talk about that. At least I didn't when I was a kid. I didn't say, oh, I knew so-and-so was here because, I had the feeling. Or you meet somebody and you just feel safe without even saying a word, the nonverbal. And I'm sure you can feel that with the patients, feel it from you and you feel it with them. That.
Yeah, absolutely. You can feel that connection. Oh, I just love what I'm doing right now. I take care of patients just on a as they need it basis, more or less. I do second opinions and consults, and available 24/7 as things come up for people. And, my consults are more word of mouth in Montana, and I lived in Hawaii for 10 years. And, I just love that. And then I'm also doing, a significant amount of medical necessity work where I'm looking at new treatments and seeing if they're appropriate. And then I do quite a bit of medical malpractice work as well, where I get to really fight for, what's right in medicine, whether it's the plaintiff or the doctor, really fight for really what's right and carefully look at all the science. So I just feel like I just feel blessed.
How do you want people to contact you through like a website or anything?
Well, I let my website go, but people can usually find me on the internet. My phone number's on the internet, and I like giving opinions or working with people, really, I should say. See what is the best therapy for them, make sure they're getting the best care that they can, and it's a nice way to get a second opinion. So I'm just feel lucky to be doing that. It's the most joyful part of the experience.
It seems like the logical extension of everything that you've done up till now. Like you've made it into this very specialized kind of
40 years of knowledge. Just
I feel very privileged to have been able to talk to you. I want to thank my friend Richard, who I grew up with, who is an attorney in Cleveland, Ohio. He said, "You've got to talk to Judy Schmidt." I said, "Oh, will she talk to me? I think she will." And then she did. You're she. And wow. So folks, if I'm going to summarize, if you're struggling with some type of a diagnosis particularly with cancer, or a loved one is, research what is the best way to treat this. and find a doctor that is knowledgeable and human. That's my 2 cents and how I've kind of come to the end of this podcast. I feel so lucky to have met you. This has really went in a way that I'm very happy about.
Yeah. And feel free to email me if there's questions come up, or, patients can do that. My email is qualitycancercare at gmail.com.
That's a good way to get a hold of Judy.
Yeah, that's probably the easiest.
Quality Cancer Care. Yeah, just like it spells, just like it sounds, at Gmail. That's what how I emailed you. Yeah. Yeah,
exactly.
So, so great. So great. I know it's 6 o'clock where you are, something like that. You're probably ready
almost
for dinner.
Yes. Something nutritious.
Perhaps a salad.
Yes.
No Doritos. No Doritos. Well, thanks so much, Judy. I really appreciate your time and all your wonderful work and your insights. Thank you.
Absolutely. And thanks for what all you do. Thank you. Get the word out.
Thanks for listening to The Exploding Human. Check out the website, theexplodinghuman.com, The Exploding Human with Bob Nickman YouTube channel, and The Exploding Human Facebook page. And again, big thanks to Dr. Judy Schmidt for a wonderful talk. She's a wonderful person, and if you need to find her, you know how to do it now. Thanks so much. Have a beautiful day.